Whitcomb, recording News and Nutrition for May 20th, 2017. And the topic this week is on Chondroitin Reversing Heart Disease. I'd never heard of that before. I had a client come to me in my practice and say he'd had a heart attack in the last couple of years and had gone on the internet finding out about it and had read about Lester Morrison. And he asked me, "Have you ever heard of Lester Morrison?" And I hadn't. I was relieved to find out he was a cardiologist back in the 50s, and that kind of got me off the hook. But he had been a researcher of atherosclerosis at Loma Linda in California and had gotten very interested in chondroitin. And his first research had been in rats and monkeys, where he gave them a diet that gave them horrible vascular disease in their arteries, and when they were given that same diet with chondroitin, he could show that their arteries remained perfectly clear. He then proceeded to do the same thing with humans and compared the humans he got to take chondroitin with controls. Now, in 60 folks taking chondroitin, compared who had heart attacks, he had 4 lethal heart attacks of 60 people taking chondroitin. But of 60 folks not taking chondroitin, there were 14 lethal heart attacks. Of the 60 people taking chondroitin, he had no non-lethal heart attacks. And when he had found 60 controls for that group, they had many more. Now, is this credible research? Actually, it's not, because it's only one doctor, it's not randomized, placebo-controlled, but the dramatic reduction has to be taken into account. So the folks who noticed this were actually looking at their, and that research was all lost back in the 1970s. He published it in Angiology 1973, and so that research was lost. But along comes the internet, and folks started finding it. And when a rheumatology clinic noticed that the people who had joint trouble were taking chondroitin and glucosamine seemed to have 1/7 of the heart disease of folks not taking it, they decided to investigate that further. And they did some basic bench research. And their bench research looked at the inflammatory markers in the blood vessel cells, what we call the endothelium of the blood vessel, and those inflammatory markers were dramatically reduced in the chondroitin group. Well, where does chondroitin come from? Chondroitin is the white stuff on chicken bones. When you bone a chicken, the breastbone that's down the middle, or the cartilage at the end of the drumstick or thigh, or often chicken wings, that's kind of chewy and crunchy. It's sort of edible. That's chondroitin. The chondroitin industry comes from extracting it from the trachea of cows. So that's beef chondroitin, but it's still the same stuff. So what will work for me? Well, the internet is now showing these new things coming to light that were lost to our recognition from before. This is a remarkable finding. I think we should all think about taking chondroitin. If you have a cardiac calcium scan that shows a calcium score of anything over 20 or 30, you should probably be on chondroitin. Lester Morrison's dose was in the range of 6 to 8 grams a day for a year. Now that's quite an amount of chondroitin, and getting that's quite a few pills. You might want to be followed by an anti-aging doctor in your neighborhood and check some of your inflammatory markers. But going forward, we should probably all think about adding this remarkable chemical food back to our regular diets. This is Dr. John Whitcomb giving you this week's News and Nutrition. Thank you.